It's the 9th of June 2022, and that day was earmarked to celebrate the people we believe are heroes or heroes. And for Mbarara University of Science and Technology, that is a very, very important day, because we believe we work alongside people that are touching lives and moving souls. Talking about that, if you're lucky that you saw this day, you need to be sure that in fact there are those that were not able to see this, not for any other reason, but because they succumbed to cardiac issues at their young age. You're talking about babies with heart complications. If there was anyone that was able to turn that around, wouldn't we refer to that person a hero or a shiro? With me today is Dr. Dorah Nampijja. Yes, the one you see right on your screen. Let's greet the viewer and we should be able to start from there. Doctor.
Thank you so much. And hello viewers. Happy Heroes Day. We know that everybody is a hero somewhere, somehow, because they touch lives.
Okay.
In their families, in their personal lives, and other people they meet. They are heroes, and we celebrate them every single day. But today specifically, we celebrate them and we thank God for their life.
Okay, very, very important. Now, if you're among those, congratulations, and we celebrate you today. But this particular moment is for someone who is going to look into a face of a mother, a crying mother, because perhaps that little soul is going due to any issue that it has, to do with heart issues. I do not know whether you look at their eyes and, going to console them, but all I know is that the mother is looking at you as a solution that is going to be for her child to continue living. Let's start from that situation. What do you go through? What is it like? Yes.
It is kind of difficult. For me, cardiology is a personal thing, because when I was still little, my mother had a similar situation. She was the one on the other side of the bench, a mother with a child, sick, without a diagnosis, not knowing. In Africa, we have different perceptions of heart disease. Some think it's witchcraft, some think other strange things. They think it's spiritual. And for me, now being on this side of the bench to give the solutions, I'm there to tell the mother that this is the disease. This is what we can do. There is a solution. And this is the plan. And for me, that's what drives me every single day, to be able to tell the mother, we will go through this. And there is hope.
Wow. An inspiration from a mother way long those days. Was that child you? Or?
It wasn't me. It was my brother.
Okay.
Yeah.
Wow.
So when he was sick, he's the one who follows me. So I was kind of so much in close contact. I kept thinking, why doesn't he play with me? Why is he always in hospital? Why is my mother always crying? And at that time, you can imagine, like in the whole of Uganda, there was nobody who could actually make a diagnosis to tell you early enough that your child has a heart problem, do this. Okay. Which saves time and saves a lot of pain for these parents and their children.
Wow.
So that's when I think it was a cry to God that I need to be someone who can make a difference in these mothers' lives. At least tell them what is wrong. Tell them this is the medicine we can do. Yes. And what makes it better for me is to find a child who came in all swollen, can't play, has been in hospital, different hospitals, to see them get from their bed, come and smile at you. And they come to you, they talk to you, they refer to you as one of their own. And it's very interesting that at that point in time, the child becomes mine. The parents refer to the child, Doctor, Omwana wawe. It's kind of, that is what keeps me going.
Okay. For someone watching us and hearing this for the very first time, how would you describe the condition that we're talking about? What does it go with it?
So pediatric cardiology is a very vast kind of discipline. We're talking about children who are born with heart problems, and then we have those children who acquire these heart problems once they're already born. For those who are born with these problems, we have maybe a little bit of control which we should talk about, have the mother attend antenatal care, have the mother feed well, folic acid to prevent those conditions that they are born with, so that a healthy mother is more likely to produce a healthy child. Then those problems that are acquired, our biggest problem here in Mbarara is a disease called rheumatic heart disease. This rheumatic heart disease is very common, and it comes from a simple sore throat. So a child gets a sore throat, it's not treated very well, and that bacteria that causes a sore throat causes damage to their heart valves. You've heard of people talking about valves are sick. So that's the rheumatic heart disease that is commonest here. There are others, but those are the major one that we deal with here every day. Yes.
And for my mother or expectant mother, are there ways those can be actually prevented?
For the congenital one, those that children are born with, I have talked about it earlier. Keep a mother healthy. We work in tandem with obstetrics. Have the mothers attend antenatal, they take folic acid, they have a healthy diet, they have their children within a reasonable age and things like that. So we advise them from the side of the obstetrician. For those that are acquired, like I said, rheumatic heart disease, we need for mothers to know that every time their child has a sore throat, they need to go to hospital and have it treated. And that alone can save many children from getting rheumatic heart disease.
Wow.
Yeah.
Let's get back to what makes you a hero. These cases finally, anyway, they are coming. You know, it's a lot of emotions here and there. In your history, do you remember a case or a child I will use saved in quotes, and you remember like you cannot forget such a case? I don't know.
Yeah, there is a child, I may not put names probably, but he's a child who has been in our care for the last like 10 years. We first saw him when he was about 5 years and came in with typical rheumatic heart disease, heart failure, body swelling, unable to play, was always admitted every month. He would be in hospital. He had dropped out of school because he couldn't be in school and he's in hospital anyway. So we kept him in care, gave him medications, and connected him to surgery. He was able to get surgery. He's one of the many people who have succeeded in getting surgery. And it amazes me that right now he's in senior 2.
Oh, wow.
He's in senior 2. He's free of symptoms. He calls me just out of the blue. He calls and says, "Doctor, you know you had holidays. I'm just calling to check on you. This is my performance." So like I'm like the second mother. When you go to school, he has to come and tell me this is what I performed like. He tells me he wants to be a doctor. He wants to be able to treat children who have been in a situation like him.
Wow.
And that for me is amazing. I call him my son.
Yes, very amazing. That was now on the case of the child. Let's go emotional now on the side of the parents, mothers and you. How do we connect emotionally?
With the mothers, we connect emotionally because we tend to see them a lot. As you know, currently, the situation in most developing countries, maybe the surgery is not very common. It's one of those miracles that we always pray for. But you keep seeing mothers and you connect, you see their pain, and you have to make sure that they understand that they are not alone in this. You're there to give them support. They have a right to call me anytime in case they are unsure. So that's how close we are, that they become family to me. That if they call in the night that there's something I don't understand, I'm supposed to be able to give them an answer, to give them a plan. So we kind of get an intricate bond where you must know, if a mother calls and says, "This is David," you must know David has this disease, this is what we've been treating, and this is how I'm supposed to talk to the mother. So they stop being mothers of patients and they become friends for whom their pain is your pain.
What actually made you to the top list of those that are going to go down in the history of the university and the hospital itself is that you're actually the only one doing what you do? Like you just said, it involves a lot. Parent X is calling from Kamwenge. You must remember the name of her child. A number of them are coming, all eyes on you. Cases, I want to believe, are many. How do you balance all these? How do you do it? We could hear from you, yes.
It's a holistic approach. I have a very supportive family. They understand what I do and why I do it. Like I said, for me it's emotional. Being a cardiologist is as an emotional part for me. And how do I manage it? My family is supportive. We have a team in the hospital. We work with nurses, we work with a postgraduate student and other doctors, so that we create a team that is supportive. For where I cannot be able to do this, I have somebody I can call to take on the mantle, that this patient is coming, these are the instructions, ABC, so that the patient doesn't get lost along the way, because the moment they get lost in the system, we lose them. So they want a certain degree of continuity. So the support system I have in family, in the hospital, in the university, keeps me going.
Wow. That is to say you have a team you're mentoring in your line?
Yes. We have a team we mentor, because you don't want to say the only one. You want somebody else to come.
Yes.
And this becomes bigger. Yes.
Okay. We could do with a request, because this is, I think, kind of, urgent or something. From the day you were young, there was no one in the country. Today, I want to believe perhaps you're the one in the region. Could there be a call to the authorities? I don't know. I do not know whether there is a call you want to put across in making sure whatever you do perhaps is thought about.
The call is for the government to support the training of cardiologists, to support the hospitals, regional referrals, district hospitals, with the ability to diagnose, because that's also a challenge. Just imagine somebody traveling from Kamwenje, like you said, those are so many kilometers to come to Mbarara to get a diagnosis. So government support the diagnosis, the training of other cardiologists, so that we can make this accessible.
Yes, thank you very much. We're going to end this with your heroic, kind of end. I know most of your work that you do, like you said, is more emotional. You're there, but of course there's some joy that you share.
Thank you so much for this opportunity, and I'm so thankful for the fact that I was nominated. I thank the nominating team for the small acts of mercy and kindness that keep us going every single day when life gets hard. There is a hero in every one of us out there. And on this day, there are people I celebrate myself, who have been my support system. I celebrate my family. I celebrate my mom. I celebrate my husband, for they've stood by me as I made this dream come true. I celebrate the team I work with on the pediatrics ward. Those people are heroes. We work through thin and thick to make changes in the lives of children, and they're heroes to me. Everybody, go out there, be a hero, make a difference in somebody's life.